training, and research literacy, they are building a next-gen medical community that is skilled, informed, and collaborative. I'm Shreyansh Tiwari, research head at Mice Labs, and your host for today. It's been an absolute joy bringing this series to you because more we justify research, the more empowered we become as futures doctor. Now, let's ready to meet our speaker. Our speaker is um, very warm welcome, sir. Let me introduce first our audience to our speaker. His name is David John, sir. He has led 40 plus research projects in surgery, oncology, and healthcare AI, has experience published in multiple international journals, including leading Q1 international journal, has paper accepted at 9 plus national and international conferences, founder of TauSquare Academy, making research training accessible and world-class, fellow and gold honor recipient into American Health Research Summit, Tokyo, with recognition in 300 plus media outlets invited peer review for multiple top international journals such as International Journal of Surgery, Global Spine Summit, Asian Journal of Urology, International Journal of Surgery Case Report, etc. I aspire an academic surgeon passionate about mentoring the next generation of researchers. A very warm welcome to you. I hope your guidance will enlighten our students and motivate them to pursue their research.
Thank you.
You can continue, sir.
Thank you so much. I would. I thank Clinically Evolve and my labs for this opportunity, especially my good friend who has invited me here today. So today we are going to speak about the importance of having a research question and how to build it. So without any ado, let me just share my screen and let's go ahead with it. So before the session starts, I would ask if my audio is clearly audible to everybody and is my screen visible? Priyansh? Yeah, okay, perfect. So with that, let's begin. Okay, today's session. So uh, before we get into it, one thing which I want to tell everybody here is that when setting up your research question is one of the most basic things which can set you up for success for your entire research paper. Because if you have a good research question, it's going to make your path 100 times easier than if you're just going to put together a research question and you're going to fumble all the way. There are going to be a lot of pitfalls that you're going to come against. And today we will go I will start with telling why do you need a really good research question, and then we would build into how do you build a really good research question where you get ethical clearances like really easy, when where it's really interesting for you to do your research project, and it is easier for you to get accepted at conferences, and it is easy to present. People award you for your work, you get citations, you're able to publish in really good journals. And all this starts not in the methodology, all this does not start like at the end of your research, all this starts in the very beginning, when where you are looking forward to see like what do I do, like how do I make my research question, like okay, this is your interest of choice. And yesterday's session, um, covered about how do you find a topic and do a topic which you're really interested about. Today we will go one step ahead. We will go about, in that interested field of yours, how are you going to find research questions which are going to make it really interesting and really fruitful for you to do research. Now, what is the importance of a good research question? Now, a good research question makes it really easy for you to do the study, because first thing is, when you go to your mentors, when you go to the institutional review board, it they approve it really quickly. They go through your entire study. It's really robust and it's really relevant. It's speaking to them as to what the actual need of the situation is. So you're not going to have a lot of hurdles in convincing people to let you do the study. And not just now, even when you'll become really big researchers, when you're going to apply for funding, it's going to become really easy for them to fund your study because your study is the need of the hour. Second thing, because it's going to be really relevant, and a very good research question is going to be well built. And when it's really well built, the reviewers at the conferences, they're going to accept your study a lot more because they know what the importance of your study is going to be. And when you're going to present your when you're going to present your paper, if you have a really good research question, it's going to become really easy while presenting. And the more easier it is, the far more impressive it is. Because most of us here are medical students or really new to research, and being able to present in your first paper, second paper, third paper is going to be very impressive. And when you're going to talk to them about this is what I've done, it's like when people are going to look at you, they're going to be really impressed. And this is the entire goal. Like even here, all of y'all are here today because you're here for the series saying that 30 reasons why you're closer to publishing than you think. And having a really good research question is one of the most crucial things which y'all can do for publishing. Because if it's a really bad research question or if it is not relevant, what's going to happen is when you go to the publishing stage, when a peer review is going to look at your paper, what's going to happen is that he's going to be like, oh, this question is like outdated, like this research question is not relevant, and they're not going to allow you to publish your paper. And what's going to happen is you're not going to able to be publish your paper in the journals you want, in the impact factor of journals you all want. And having a really good research question before at all you start your entire research is going to make it really easy at the end. And last and not the least, when you have presented in conferences, when you're going to publish in a really good journal, obviously the citations are going to come. And this is the cycle of research. So let's keep all this aside. Now, everybody's gonna ask me one single question. It's like, wow, like I didn't know that a research question was like so important. So how do I build these? And let's learn that today. So these are the objectives. So before getting into actually how do you build the research question, there are some things which I want to teach you guys, and these are my objectives, which is what is the knowledge gap? Okay, what is the research question of the study? What do you mean by the rationale of the study? And we're going to go through a little practical hands-on application and a little frameworks which I have built. So let's go ahead. Now, when y'all are looking at this, y'all are like, what am I looking at? And it's analogy time because I want to ingrain these topics at such an abstract level that whenever somebody is going to talk to you, y'all are not going to talk to them like, yes, I understand research jargon is great, but then understanding and knowing something at a fundamental level is very important. Now, this is all of you. This is you. Now, what are you doing? So, I'm going to lay out the context for y'all. So these things which y'all are seeing, these green things which you're seeing, this is all the knowledge in the entire world. This is all the knowledge in the entire world. Now, this could be in like the pathophysiology of a disease. This could be in treatment of a disease, the diagnosis of a disease. It could be in prevalence of a disease. It could be anything. And you all can see this big gaping hole which is there in between. Okay. This gaping hole is nothing but your knowledge gap. And this scientifically, if you all want the scientific definition, is going to be the discontinuity of knowledge in medical literature is called knowledge gap. So, in the most abstract sense, in in this world of full of knowledge, so much knowledge is going to be there in every field in cardiology, gastroenterology, surgery, oncology. There is so much knowledge on how to we treat the patients in every step of the way. How to diagnose it, how they're going to present to you, what are the side effects in every single step, in every single disease. You have knowledge, and there are some times where you don't know what to do. Like nobody knows what to do. The entire world is like, oh, I don't know what to do, and those I don't know what to do is basically your knowledge gap. Now this can be of two types. You can have a knowledge gap saying that I don't know what to do. And what do you do when you don't know what to do? You'll go read. You'll take your gold standard textbooks, you'll ask your seniors. So that's what you do. What do you do when the entire world doesn't know what to do? So when the entire world doesn't know what you do research. Okay. So I hope that the concept of knowledge gap is really clear, because I'm going to go to the next one, which is this. What have you done here? Okay. And why is it like this? What are these bamboo sticks doing? Simple. So now that we know what a knowledge gap is, this is you again. And you want to be a great world class researcher. World class researcher. And believe me guys, I'm not just telling this like for fun. I truly believe, even as beginners, if you all do research properly, you all can be world class researchers. So, as world class researchers, what are you all going to do? You're going to build a bridge. You are going to build a bridge. Now, in the most simplest formats, in the most simplest language, I can tell you that a research question is nothing but that bridge, where the person who doesn't know what to do somehow has a pathway to know what to do again. Now, let me explain. You are not building like the Golden Gate Bridge. You are not building the Howrah Bridge. You are not building a fantastic structure. You cannot do that alone. But what can you do? You can give people a narrow pathway to move across from what they know to again what they know, which means you're filling up the gap. And this is what your research question is. Now, why am I saying that this is not the Golden Gate Bridge? Why am I telling that this is not the Howrah Bridge? Basically, because a research question is supposed to be, and especially as beginners, as most of y'all here, what's going to happen is your research question is supposed to be really direct, really specific, and really narrow. You're going to be like, you don't know about this one particular thing, and my research is going to tell you about that particular thing. You're not built, and I'm telling you, slowly over the years, if you continue doing research in the same pathway, you're going to build a narrow bridge over a narrow bridge over a narrow bridge over a narrow bridge, where someday, probably, some of y'all might build these fantastic bridges. But at least now, at least the way I want you all to think about it is that you're going to build a narrow bridge. You're going to build a very direct, specific, narrow bridge from what we know to what we know. Basically, you're covering up what we don't know. Now, this is your research question, and this is what I will teach you all how to build today. And not just a bad one, a good one. Okay. Now, when you go to present in conferences or when you are writing your paper, one of the big, most important thing which everybody is going to ask you, leave that. Your parents, like your peers, everybody is going to ask you, oh, why you're doing that research? And why you're doing that research? Like, why? The reason why you're putting this specific bridge in this knowledge gap is the rationale of your study. It's basically like if you're going to put a bridge like this, why not a bridge like this? Why not a really like complex bridge like this? Why not the Howrah Bridge? Basically, the reason why you tell them that this is the particular bridge which I have chosen to fill the gap, so that a person who doesn't know will know right now, is your rationale of your study. Okay, so with this basic understanding of and a very abstract fundamental understanding, let's move forward. So there are a few things which I want to tell you guys here, and the things which I want to tell you guys are very simple. Now, again, let's go into this real world. Okay, and as most of you here, you all would have definitely at some point in your life thought, hmm, I must go find out which is the best way for you to study. Or you might have been like, okay, I want to try out a new diet, or I want to try out a new workout, or I want to try out a different direction to going to college. So all these questions are like real life everyday questions. And what is the first thing you'll do? You'll open up Google and be like, Google, what is the best diet which I can try? Like maybe to lose weight, maybe to gain weight, maybe. I don't know. The reason is yours. Now, what does Google do? Google gives you all the answers. everybody's answers. Now, in this, there are only three things which were possible. First thing, either you all will find an amazing answer which totally applies to your situation, and you're like, perfect, like this is perfect, this is what I wanted. Okay, that's the first thing which could have happened. Second thing is complete bogus. Like it couldn't like when you read it, you're gonna be like, no, I'm not gonna do that at all. It does not apply to me at all. And the third thing which is gonna happen is when you're gonna talk about diet, they're gonna talk about something like not even relevant to you. So these are the three things which could have happened. So, and this is the problem with research too. So when y'all want to know what to do, y'all need a GPS. Y'all like when y'all are going to a destination, y'all need a GPS. And that GPS is going to be your frameworks. Based on these frameworks, we build these research questions. And there is one more thing. How do you know if the GPS is right or not? Like, how do you know that? You don't, right? I mean, but there is somebody in the background, who has checked the routes, who's made sure that, whatever GPS is showing is right. And that is the other framework which I'm going to talk about today. And that is your quality control framework. So these are the two basic frameworks which I'll be teaching you all. And I know that other experts who have been on this platform have also explained. So we will be going one step ahead. But for people who are newly joining here today, I'll be just giving you a brief of that, and then we will be going in far deeper so that you all can build a really good research question. So first framework which you all need to have is your PICO framework. So this everybody knows. P is for population of interest, I is the intervention group, C is your comparison group, and O is your outcomes. So based on this, literally only and only based on this, do you frame all your research questions. And there are multiple variations of this where you can sometimes remove the comparison group, you just have a population intervention outcome, and sometimes you have the comparison group. There are multiple differences, there are differences in this. And even in outcomes, one outcome could be like therapeutic, one outcome could be diagnostic. It could be very different things based on your methodology which you're going to choose. And today, like, this is your PICO framework, this is your GPS. And there are some pointers which I want to give you all. This is what I call pro tips. So whenever you are making your research question, please have your PICO always. The reason for that is most often than not, which means as a rule of thumb, what's going to happen is your PICO is going to be your keywords. And why are these keywords really important? Because these keywords will help you search the literature. I'll give you all a small statistic as to explain to you all why these keywords are really important. So the medical knowledge which we have, which means the medical literature which we have, doubles every 7 days, which means every 70 days, not 7 days. I'm really sorry about that. So the knowledge which you have, the knowledge which everybody has, literally doubles every 70 days. So when literally in every 2 months, whatever you read is going to be outdated, or there's going to be new things which keep coming. So how are you going to keep up with that? How are you going to create research questions which are relevant? And basically keywords is your answer. If you have keywords, you can target the research which really is relevant to your particular topic. Like once you have a knowledge gap, you will build a research question, and this research question will guide you to, like, based on your literature search, it'll show you why is it important, it'll give you the rationale. So your keywords is a very 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 important thing, and your having your peak at all times is very important. So this is your GPS. Now, I told you guys, you all also need a quality control, and your quality control is basically your finer, this finer. And these are like, like one, like you can take F, which is feasible, I is interesting, N is novel, E is ethical, and R is relevant. Now, I have seen the previous episodes too, and I've seen everybody, like all the experts, talk about Pico, talk about Finer, and they have talked in such great detail. And today we'll just go a little forward. I'll just explain these things to you all, and then we can actually go into the methodologies where how we can use you all. I'm going to show you all the application part of these things, which is going to be very important, so that you all don't get confused as to how am I actually supposed to use these things. So if let me just explain this really in brief before going forward to what I have, the core of what I have today. So the first thing is it feasible? Now, if you're a postgraduate in India trying to do research, okay, the first thing which you ever need to know is that you have 3 years. In 3 years, in final year, they do not allow you to do research. So by the end of second year or beginning of third year, your research should be complete. So as your first, like if you're going to be in your first year, in the first 2 months, they're going to start telling you to start doing your research. So basically, you have around 1.5 years. So when you have 1.5 years time, you cannot plan a 5 year study. You just cannot. That's not feasible at all. Okay. Next thing, do you have the money? Now, example, if you are supposed to fund your entire research, and if your entire research is like using genetic tools and things like that, and if you're going to do that for 200 patients and it requires you to spend lakhs of rupees, like 50 lakhs, 30 lakhs, like I don't know, 1 crore, like are you really ready to spend so much money for research? Probably not. And can you get funding? Again, in that short period of time when you're going to do your research only for 1 year, probably not again. So these are feasibility questions which we need to ask. And coming to the next thing, which is interesting. Now, this is a very, very confused topic and a very controversial topic. I will give you my opinion. However, there are other opinions which y'all can take for sure. And my opinion is this, that research should be interesting for whom? Should it be interesting to the HOD? Should it be interesting to your professor, to your mentor? Should it be interesting to the peer reviewer? Should it be interesting to the journals, to the community, to a conference? Who should it be interesting towards? Like, what does this even mean? Like, interesting? What's interesting for me might not be interesting for you. So, what does this mean? And my answer is very, very, very simple. Please do not care about the rest. If you find a topic really interesting, if you are passionate about that topic, go for it. And it could be the most boring topic ever. Like nobody cares about it. But if you are interested to talk about it, people will listen. If you are passionate about it, people will listen to you. People will come for you. Basically, it'd be like, oh my god, how is this person so enthusiastic about this? What is this research about? So people are going to come if you are interested. So prioritize yourself. You are supposed to prioritize yourself and you are supposed to find it interesting. Coming to novelty. And this, again, not very controversial, but this is my own framework as to how we can build world class researchers in a very, very short amount of time. So, one thing which I have seen, especially in the Indian scenario, is that we like to replicate a lot of studies, and I have seen even past educators, past experts tell that in India we look at a different study and be like, oh, we can do that, and that's great, because in India we have this great thing, jugaad. So we find a really really costly thing, or we find something really interesting to us, and we're like, I bet I can do it way better. And I'm telling you guys, that is why y'all can make great researchers, and that is the novelty which we want. However, we do not want replication. We should not go for replication. If somebody has done a research, just doing their research maybe like faster, or just doing the research more cost effective is great. But then, if you are able to channel that creativity into creating something new, you it's going to go off the chart. It's going to literally go off the chart. So it's supposed to be novel. It's supposed to be which nobody has ever done before. When you start doing things which nobody has ever done before, it's going to be novel. People are going to look at you. Next thing, which is supposed to be ethical. Now, uh, the only thing which I want to tell everybody regarding ethics is that please don't disregard it. Ethics is your biggest tool to anything in life. If you are ethical, if your intentions are good, you will open places which you cannot even imagine. Because the world does not care about brilliance. The world cares about if you are good, if you are ethical. If you're going to go to John Hopkins, if you're going to go to Stanford, if you're going to go to the Ivy Leagues, if they want to take you, they don't care whether if you're brilliant or not. Because if you are, let us say, for suppose, I am unethical. I'm a very bad person and I'm an unethical person. If John Hopkins takes me, what's going to happen is if I do something really bad, and it's going to come all over the news saying that John Hopkins has taken this really bad researcher, and then it's going to bring down the name of John Hopkins. So basically, they would actually prefer not taking me, however brilliant I am. They're going to take someone else who's far, far, far more ethical than me because being ethical is a tool. And please never, 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 ever be like, oh, it's just ethics. No, it's not. It's your tool. It's your single most greatest tool to achieving things which you will never even think is imaginable. And being ethical is very simple. Being ethical makes your research so robust. Like I'm telling you, as a peer review, when I see papers and if they have followed every ethical rule, I am telling you there is nothing wrong I can find in their paper. Literally nothing wrong. So just being ethical, which is I do understand it's a little bit slower going and taking ethical clearance, making sure we take consents of the patient, making sure you're following every step of the way is going to make you a really ethical researcher, first thing. And second thing, if people are thinking, oh, nobody notices all that, trust me, they do. Trust me, they do. There are so many professors when they are looking at your paper. I'm telling you, they are going to because they lobby for human rights and all. They look for it. So please use this as your greatest tool to doing great things in life. And about relevance. So this is very important, and this is one pitfall which I've seen brilliant people fall into. So one of the biggest things which I have seen really brilliant people do is because they're I'm telling you they're literal geniuses, clinicians, diagnosticians. Like I'm telling you, I would literally bet on them saying that they're geniuses. And what they do is because they're really enthusiastic people, they take really complex questions. They take questions which are not relevant in the field, which nobody cares about. And what happens when this happens is they get lesser citations, they get lesser presentations. And when this happens, when they are not able, they're not shown compared to a peer. Like example, let us take somebody else and they just followed all of this and they're like, I just want to be relevant. Okay, I'm really interested in this topic. I'm going to take this topic and I'm going to conduct a really simple study. And if it is relevant, they get more citations, they get more presentations. And by this, what happens is you build a 30-year career, build 10 years career. The gap between the actual brilliant person and the really simple person is going to be night and day. So making sure that your research is actually relevant, which means, let me give you a very small example. In the year 2022, if you in your paper did anything with COVID, it was highly relevant. It would be cited hundreds of times. So many people would have seen it because nobody knew about it. In 2025, right now, if you, unless and until you're talking about long term effects of COVID or COVID vaccines, unless and until you're doing that. So let us say you are doing a research about COVID right now, today, nobody is going to see your paper. Literally, nobody's going to see your paper. And this has nothing to do with your brilliance. This has nothing to do with your hard work. It's just a matter that it is not relevant anymore. So, with that understanding, with this basic understanding, I want to go much, much deeper. And There is one more thing which I want to talk about here is that most of us, we read textbooks, especially in India. I've seen a lot of people read brilliant textbooks, and we read the gold standard books. We are definitely better clinicians than anybody in this entire world, and you can quote me on that. And this because we read a lot of textbooks, and this comes from vetted knowledge. This is called vetted knowledge. And this means that all these years of research which other people have done, you are consuming and you have a lot of knowledge. Now, there is a secret knowledge which you have, which you might realize you have or not, but you have a secret kind of knowledge. And this is your empirical knowledge. Now, y'all might be like, secret knowledge? I have this? Where do I have it? Please tell me, I want to use it. And this is your clinical postings. This is your words. When you are going to the wards, when you are looking at patients, when you are talking to patients, you are giving direct observations. You, in your mind, in your mental models, you are looking at patients, you are making these observations. And what happens is, not all of your personal experience is going to be about what is written in the textbooks. And the difference between your textbooks knowledge and your personal knowledge will become one of the greatest areas for you to do research on. And I will actually elaborate on this much more. But this empirical knowledge, we will see how we can convert into actual real life effective questions, which I'm telling you, it's not about, I'm not talking about, forming a question for meta-analysis or forming a question for a clinical trial. I'm going to show you all at every case, like as a case report, at case in an animal study, what we're doing, in letter to an editor, in opinions, what we are doing. I'm going to show you all a framework where you all can know, okay, so this is the question I need to ask. And if this is my question, that's the research which I need to do. And that is basically the core of what I wanted to do. Before that, there is a very small thing which I want to talk about, which will actually give you all the terminology to talk to people. Because when you talk to people, you cannot just give them abstract thinking, you need to be able to define these things. Okay. And the reason why I give you an abstract thought process is your definitions don't matter. You can look it up. Albert Einstein said, don't remember anything if you can look it up. Don't follow him, y'all will fail in your exams. Please don't do that. I know all of y'all are great and y'all are actually doing really well in your education. So don't quote me on that. But all I'm trying to show y'all is that, have a really abstract thinking for many things. So let's go with the first thing, which you need to know is whenever somebody is talking about aim, like when they ask you, what's the aim of your study? Okay. It's not the objective of the study. It's not the hypothesis of the study. It's not the rationale of your study. This is different. This is research and this is confusing, but this is it. And these pictures which I've kept here is going to explain to you all what I'm talking about. So the aim of your study is your North Star. It's the it's I wouldn't it's your passion basically. Why are you doing it? Like it's not the rationale of your study. The rationale is just telling you that okay, this is the knowledge gap, so I am having to do it. But the aim of your study is what you are doing it. Like you could have done about 100 different things. Why are you doing this particular thing? I'll give you an example. So this could be because of your personal experiences or because you'll have seen patients who are suffering from it. Like you can say, I want to improve the outcomes for patients with really severe migraine. And the reason could be because you are suffering with severe migraine. You know how much you're suffering with. Maybe your parents are suffering with it. And once you all see this, it changes you. And that becomes your aim. That becomes your North Star. That becomes like, this is why I want to do research. That's your aim. Now, let's go to our objective. What is your objective? So when people are asking you what's the objectives of the study, they tell more than one. They don't be like, what's your objective? It's not a one single thing, but these are multiple things. These are really specific things. Like these are very narrow things which you will be doing. Basically these are the steps. These are really measurable you're doing in your study. So these are specific measurable things which you'll be doing in the study. I'll give you an example. So if my aim is literally to help the outcomes of people with severe migraine. The objective of my study could be, see, I could be doing anything. I could be doing a case report, I could be writing an opinion, or I could be doing a meta-analysis. And I'll give an example. Okay, if I want to do a trial, okay, and I'll be like, I want to determine, like, if there's a new drug which came out, if there's an old drug which came out, or you want to test something. Okay, you'll be like, I want to determine how effective this treatment is in reducing migraine. It could be the intensity, it could be the frequency, it could be any number of things. And I can say I want to see the effect on frequency, that's one objective, on intensity, that's another objective. So there are multiple objectives which you can have in the same study. So that is what an objective means. And hypothesis. And I've written bet here. So basically, your hypothesis is your guess, is your bet. You're like, and this bet which I'm talking to you about comes from your empirical knowledge. So you already have the vetted knowledge. You have the vetted knowledge to be like, okay, what is the pathophysiology? You understand everything about the study. Really sorry, guys. So you know everything about that particular study, and that you literally know the entire literature. That's vetted knowledge. But you'll have a hypothesis. You'll be like, I bet that this is the reason why that's happening, or I bet that this treatment could be better than that treatment, or I bet I can do this better than that. That is your hypothesis. So that is your specific. It's, again, I'm telling you, it's very specific. It's not broad. It's not like, okay, I can treat it, I can cure it. Nothing like that. It's very, very specific, and it is testable. You just cannot say something and you like not able to test it. If it does not help the patient, it's not an hypothesis. It's not useful at all. So that is your hypothesis. So with this understanding, let's move forward. So these are the different types of studies which everybody knowing, whoever's crossed third year, whoever has seen, who's gone through SPM, whoever has read Park knows all of this. And I'm not going to teach you all of this. The only reason why I have put this here is I am going to do the most amazing thing now, which is I've shown you all the PICO framework. I've shown you all the FINER framework. I've explained the FINER framework. The FINER framework is more like a quality control. So we will not focus on this, but we will focus on the PICO. I will show you guys, when you all look at knowledge, when you all look at your empirical knowledge, your personal life, or when you all are looking at when you look at a knowledge gap, you want to fill these gaps with a research question. So to do a research question, you need to do a research. If you're doing a particular research, you need to do either one of these. It could be this, it could be this. These are the tools which you're going to use. And I'm going to show you how you can use your Pico in each one of them and how it's going to be different. And I'm telling you guys, I have a secret reward for all of y'all who's going to be here, and who y'all can use my own playbook where y'all can make great research questions. Okay, let's just go forward. Okay, so the first thing, LTE. So that is your expert opinion, letter to the editor. So I've seen a lot of new medical students trying to do letter to the editor. It's great if you're going to do about your own opinion, if you're writing about your own opinion. However, as a first year medical student, second year, third year, you don't have a lot of clinical experience. So a letter to an editor is supposed to be written by an expert. Why? Because an expert has seen thousands and thousands and thousands of cases over so many years. So he is going to have the empirical knowledge which is not tested in research. And he's going to have hypotheses. He's going to have bets saying that probably that's why, probably that's why. And he is the best person who can write your LTE. So if y'all want to write a letter to an editor, the first thing which I would tell y'all to do is go to the biggest, like go to your HODs, go to like retired professors, like who are just retiring or retired or not, because they have years of experience and they're going to tell you what they think. And this is the beginning of all research. If a person is able to hypothesize this is why it's happening, you can test it. And testing it is usually where research begins. So that is your letter to an editor. And in letter to an editor, it's basically giving your own opinion. So that's your research. So what's happening here? What's your hypothesis here? What's your opinion here? This is completely an opinion. Now, coming to an animal study. In animal studies, you do basically to find out the pathophysiology of a disease. So, if you don't know how something works, if you don't know how the disease is going to progress, you will not know how to cure it. So, in animal studies, all they do is they try to understand the mechanism. Most of y'all would have finished like your biochemistry, and y'all would have seen so many cycles. Why do we know these cycles? In pharmacology, y'all know so many drugs which goes and affects at every receptor. Why do we know all this? Because when we know the mechanism of the disease, we can stop the disease. And that is why animal studies are very important. So just understand when you're going to make your literature, like when you're going to make your research question, that if you're going to do an LTE, it's going to be about an opinion which you're giving. That's your research question. It's your opinion. What is your opinion on this particular thing is your research question. If you're doing an animal study, it'll be basically like, we don't know what the pathophysiology of this particular disease is. Like example, for COVID, we didn't know. So we'll be like, we don't know what the pathophysiology of COVID is, and we're going to find out. So that is your research question. Now coming to case studies, case series. These are very rare events. These happen very, very rare. And you are, publishing that paper so that people will know. And I have actually written this here. So how is the question formed? It's a very purely descriptive study. If you all have actually attended yesterday's class, you all will actually see Mohammed explain what a descriptive study is. So basically here in a case study, in a case series, you are trying to say what's happening here. You're going to say a patient presented with a very rare disease, or the patient presented normally, but I diagnosed him in this very like fantastic way, which is like much better. So that could be in your diagnosis. Or you all can tell him that we treated the patient in this completely different method. So that's your treatment, that's your diagnosis. So if you have novelty in any one of those, you can write a case study. And in especially in a case study, what's going to happen is this is going to happen. Your population is going to be the patient. So in a patient with condition X, what is the clinical outcome after a novel exposure? So basically, if you are going to give a new treatment, what is going to be the clinical outcome? Is he going to like do better, like do much better, or what happened to him? Like what was the follow up? That is basically your LTE, your animal studies, and your case series, your case studies and case series. Going to the next one, cross-sectional studies. The most basic thing which everybody needs to know is cross-sectional studies are nothing but snapshots. It's basically like, think of yourself that you are standing here clicking a picture, and everybody, like, you're taking a picture of the entire, like you're just taking a picture at that particular time. So and this comes in prevalence, this comes in knowledge. I am sure many of y'all would have done what a knowledge, attitude, and perception study is. Okay, this is like very famous among medical students. That is a cross-sectional study. In this particular moment of time, what is the knowledge, what is the attitude, what is the perception of medical students, nurses, doctors, patients? It could be anything. That is a KAP study. And one more thing is, you can check prevalence, how the like how many people know that, like or this disease is there in how many people right now, as of right now. And the PICO example is like this, like it's going to be like in university students, that's your population, that's your interest group. What is the prevalence of depressive symptoms? Okay, and compared to exposure, like with low physical activity at this point of time, basically when you're doing that research. So that is how you frame your PICO for a cross-sectional study. You are giving them a snapshot. Okay, let's go. And this, I'm going from level, like this is level 1, and I'm going all the way to the top, guys. So y'all can see level 1, I'm going to level 2, and now I'm going to level 3. And what is this machine? I mean, what is this symbol which I've put? This is rewind. You go back in time. Basically, this is our equivalent to time machine. This is the medical equivalent to time machine. So basically, in a case control study, what you're doing. So you have a patient who's presenting, let us say, with some sort of cancer, and they're like, let us say it's a 10-year-old child who's presenting with a particular cancer, and you have so many other 10-year-old childs who don't get that cancer. Now you want to know, why did this child get cancer? Like why? So what you'll do, you'll rewind, and you'll see what was the reason. what was the cause for that child to get cancer, and that becomes your etiology. So if you're doing a case control study, or if your research question, if you have seen empirical knowledge saying that, oh, I think because people are doing that, they're getting this disease, you can test it with a case control study. Take all the people with that particular disease, go back and take another set of very similar people who have not got the disease, go back in time, check what happened, like what were they exposed to continuously, and check why do they get the disease. So the PICO example is in children with leukemia and who have a higher exposure to household pesticides, which means farmers' children and all, and compare it with people in the city who don't have that exposure, and check if leukemia is more in which group of children. That's your case control study. Now, going to the next one, cohort study. Now, we just rewinded, right? Let's go forward in time. So, this is another way. So, what happens is in a case control study, there is a kind of bias called recall bias. You cannot, and there are so many confounding factors. There are hundreds of reasons. I'll give you a recent example. Trump said if you have paracetamol during pregnancy, it causes autism. And this was actually, I'm like, very questionable. I'm not here to talk about politics. But what we can do is, see, if he's done a case control study, he would have gotten back in time with people who have autism and seen if the mothers have taken paracetamol or not. But here, no, there are a lot of other biases. But going forward in time, if you're able to check, so we can take normal mothers, okay, and we can see we are not going to give them paracetamol. We don't want people to have autism. We're just going to observe. We're going to see what happens. We're going to see what happens, and we're going to check how many mothers have autism or not. Like how many mothers have children who have autism, basically. And basically, then we're going to come to actually saying that okay, this is what happened. Like if you all take yesterday, if you all attended yesterday's class, ma'am was talking about smoking causes cancer, and they did a cohort study. They followed up the patients over a long period of time and seen that people who were smoking got cancer. And another example, in healthy middle-aged men, people who do regular exercise compared to the people who don't do exercise. Basically, this is your exposure. In 10 years, who all are going to get a heart attack? That's a great cohort study. Now, if this is feasible for each one of y'all, you need to be able to check that for yourselves. Okay. I'm here just to show you all that how y'all can frame research questions, not just for like one particular study, but for all these studies. Now, coming to the thing, this is the gold standard everybody wants to do. Trust me, guys, it's really it's time taking, it's exhausting, it takes a lot of time, but it's awesome. Okay. And this comes completely different. See, in your second year pharmacology, everybody would have learned the phases of trials, phase 0, 1, 2, 3, 4. And then basically this is like, if it's about efficacy, it's about safety, if this particular treatment works, then, the standard of care. And these are what clinical trials are. And the same thing, the PICO is the same. So in patients of severe migraine, a new drug compared to a placebo or an old drug or a standard drug. So you can take triptans versus a new drug which has come out in the market and with particular outcomes. So this becomes your RCT. And the last, the peak, the gold standard of the gold standard, systematic reviews and meta-analysis. Here, when I'm telling you guys, when you do an RCT, and there are multiple RCTs which are there because you have to do 1, 2, 3, 4, and they're done in different populations. And when these RCTs are not able to decide, when they are not able to decide, when there is no general consensus, you can do a systematic review and meta-analysis. If you do a systematic review and meta-analysis, that is the final verdict. Basically, if you are able to conduct a very good systematic review and meta-analysis, that's it. Like that's the end. Like what you said, that will go into the guidelines. Unless and until a new trial comes or something new comes up, that's going to be the gold standard. And another example of that, same, you can use the same PICO framework. Population group, type 2 diabetes, Interventional group is SGLT2 inhibitors. Standard of care could be anything, and then you check for a particular outcome. And all this guys needs to fill, and like these are not actually research questions. These are examples which I've built, but all you need to do is you need to go and find the knowledge gap. You need to find this. Only if you find this, you will be able to put your research question. And I have shown you all how you can use your entire methodology and how you all can build this bridge. So I have shown you guys this. The only thing which you all need to do is need to go and find a knowledge gap. And then you all can go ahead with your research question. Now, the last thing which I want to tell. This is your takeaway. Please be observant in your words. Please go to your words. Please go and touch the patients. Go talk to the patients. When you talk to the patients, when you see, like example, you've given the patient treatment, okay, and the patient had a side effect, okay, that becomes your empirical knowledge, and you can be like, okay, like I'm not sure. You'll go and you'll go and you'll search online if this has happened to others. Not happened. That's a great knowledge gap. What's going to happen is if you decide to do a case study, be like, what is this case? Like you are reporting first thing, you're reporting something novel which has never happened ever before, reporting first. And the second is you are trying in a case study, in your discussion section, you'll be putting what is this side effect, why is this happening, how did we treat it. You're going to give knowledge to so many other clinicians. First thing. Second thing, if for the same patient, you want to be like, okay, so this patient got this side effect. Now, is it because of this drug? Can I blame only the drug? It could be anything else, right? So what you will do? You can conduct a case control study. You can be like, I'll take all the patients with this side effect. I will go back in time and I will see if it's because of the drug they're getting the side effect. This is gold, gold, gold standard. And as you'll go even higher in your careers, because you are in your words, you have seen that a patient who was taking a particular drug got that side effect. You can even do an RCT which says, if I give this drug to people, it's causing, like, it has a safety concern, and the safety concern is this side effect. So, guys, I hope I have equipped you all, saying that not just in one particular study, not just in one particular methodology, but in all methodologies, so that you all can convert your empirical knowledge, your personal knowledge, your superpower into any research paper. And now, time for the surprise gift. And the surprise gift is nothing but I had the opportunity, I had the honor of writing so many research papers, going and presenting in multiple conferences, and right now, even being peer reviews and actually right here before you all. So I'm going to give you my playbook completely. Like you all can take my playbook of how I find research questions, and you will find methods which I was not able to elaborate here in this class, and you all can use it completely for free. So it's basically like a checklist. So this is your checklist which is there. You all can scan it and you all can freely download it. Nothing, like, you don't need to give anything. It's completely free, of course. Just scan it, download it. When you all are going to create research questions, go through that checklist. So there are 5 phases to the checklist. Make sure you all tick every phase of that checklist, because if you are able to complete that complete checklist, I am telling you, your research question is literally, you're competing with the world. You're literally competing with the world. So there is nothing which is going to stop you all. I'm actually even going to forward this to the team at Clinically Evolve and even at Mice Labs, so that they can send it to you in your WhatsApp groups for all of y'all. So it will be helpful for all of you guys. Okay. So right now I will take questions, guys. This was my presentation. This was my opinion, and I hope that y'all are able to take a lot of value from this, and I really hope that all of you can build great research questions and go out there and present your research and just be amazing. So I'll take any questions right now.
I request if anyone of you is having any question, you can unmute yourself and ask. So,
How do we mentor? Uh, Hi Kevin. Hope you're doing well. I did not understand the question. What do you mean? How do we mentor? You can just unmute if you want, or even to guide if the question is good or not. So it basically it's based on your knowledge gap. So as I told you, you will be see if it's feasible for you. Like when you're using the finer technique, that's your quality analysis. So when you know it's feasible, okay, when you know it's really interesting to you, when you know it's novel, nobody has ever done it in the entire world, and you know you're going to get ethical clearance, okay, and it is relevant, everybody's talking about it. It's a great question. And the most important thing which you can know about if it is a good question or not is, does it solve a knowledge gap? Like the gap in knowledge which I told you, it is paramount. If it does not solve a knowledge gap, no matter however good your study is, it's going to be bad. So the simple question is, it's not even about the methodology. You can do a case report, case study, you can do a letter to an editor also. But if you are not able to build a bridge, that's not a good question. So you need to build, see, if you're going to build a bridge on already a bridge, that's not going to make sense to people at all. People will be like, I already have a bridge. Why should I take your bridge? So the better question is, you're going to build bridges where people cannot go. So finding a knowledge gap is the most critical thing which you can do. And then you just use the PICO and you can use the finer frameworks to build a really robust question. But the most important thing is your knowledge gap. If you are able to solve that, it's great. Like you have a great question. So I hope I was, yeah, no problem. So guys, if anybody else has anything, any other questions y'all can ask. Do we have, okay. So where do you recommend to go and read articles to stay updated? So completely depends on your field, Kevin. So one secret method, which I personally do and I ask my students to do, is you will have a society. So depends on your interest. So let us for example say that you are interested in dermatology. When you are interested in dermatology, you will have a gold standard society. So you will have the American Association of dermatology. You will have the European Association of Dermatology. You will have the Indian Association of Dermatology. And what happens is in all these uh, big uh, communities in these societies, they have either free student memberships or they have very low. It's like $10 or $20, which is like 1,500 rupees for the entire year. So that's like two pizzas. Okay. So don't worry about the money, just spend that. So what happens is when you go into that society, they're going to send you a journal every month. That's one thing they do. Or second thing is they have specialized news feeds which they send to you, where they're going to talk to you about trials. So each of so and they will have live webinars every day, not every day, at least once in a week, where they, because they are fostering a community there. And if you are really interested about that, when you attend all of their webinars, when you are in their community, when you are reading their journals, you're going to be updated in your field. It's as simple as that. It's, if you have the passion for it, go and become a member of these societies. If when you are a member of these societies, they're going to send you like journals, like which is actually you have to pay a lot of money for these. Okay, so they send it to you, and because you are a student, it's like a $10 or $20 fee. They send it like, and it's only one time payment per year. So for the entire year, you can stay updated to the current clinical knowledge. And the best and the last thing which I would actually tell you to do is, if you are like a beginning out, I don't know what has happened till now, okay, and I want to move forward. One of the more best things which you can do is you can read the clinical guidelines. So if you want to know about how do I treat a particular disease, go read the clinical guidelines. The clinical guidelines will tell you everything. So it will update you till there. The second best thing which you can do is you can go read literature reviews. A lot of experts, write these literature reviews. So there are literature reviews which says like heart failure, it says past, present, and future. So when you're reading that literature review, it's going to give you like an idea about what happened in the past, what's happening right now, and in the future what are we going towards. So literally in just one article you're going to stay updated. So these are my personal techniques where I try to stay updated in the fields of my interest, and I highly recommend that you do the same. No problem, Kevin. Thank you. Anybody else? Any other questions? Anywhere where y'all felt, oh, I didn't understand this. So y'all can ask me.
Yes, sir. We don't have more questions, so we can move towards the conclusion. I extend a heartfelt gratitude to Mr. David John, sir, for taking the time and to be with us and for delivering such an insightful lecture on how to frame a research question in PICO chart. His clarity, practical examples, and emphasis on clinical thinking have truly deepened our understanding and foundation of research. Your words have not only guided us, but also inspired us to approach research with curiosity and precision. I would also like to thank our organizer and participants for their active involvement. Once again, thank you, Dr. David John, sir, for sharing your expertise and wisdom with us today. We look forward to more such opportunities of learning from you in the future.
Thank you so
Thank you,
much.
everyone.
Thank you so much. Thank you, Shreyansh.